Our next speaker is Janet McNeill. And I believe one of the previous deputants left some photos there. Christine, I believe your photos are still there if you want to collect them, please, just so other deputants are not using them.
I'm happy to have them here while I'm speaking. I don't have a problem with that.
Okay. Thank you, Janet. You can start when you're ready.
Please don't give me a warning because I've timed this so carefully you'll just distract me if you give me a warning ahead that I'm running out of time. I spoke to you in April about some things I've learned about vaccines since becoming a grandmother. Today I want to discuss censorship. The Board of Health is being encouraged to join and amplify what's become a major movement towards severe restrictions on access to information about possible downsides to vaccination, actual risks and side effects. Google is restricting searches for this information. The censorship pace has really picked up this year. You may not know Google now has a pharmaceutical division headed up by the former head of GlaxoSmithKline's global vaccine business. GSK is one of the big four pharmaceutical companies, along with Merck, Sanofi Pasteur, and Pfizer. It's pretty surprising how deeply vaccine orthodoxy continues to be accepted among us when you consider that the very industry that brought us thalidomide, Vioxx, the opioid crisis, and many other drug scandals is the exact one we put our trust in to make vaccines, and that they were released by U.S. Congress in 1986 for liability for any harms their vaccines cause. Seems like some pretty serious cognitive dissonance is at work here. You do know the Toronto library system is already deliberately restricting books about vaccines available to its reading public. Earlier this year, I and others asked the library to buy some informative books about vaccines, one of them a bestseller from the day of its publication. I was told books by MDs would be favored, which doesn't really make sense, given that anyone can do deep research and publish a compelling book. I put in a request for 5 books, 2 of them by MDs. No dice. Not one has been added to the library collection. I can read Mein Kampf at the Toronto Library, but not Dr. Suzanne Humphrey's book, Dissolving Illusions, Disease, Vaccines, and the Forgotten History, or Dr. Richard Moskowitz's book, Vaccines, A Reappraisal, or Neil Miller's Vaccine Safety Manual for Concerned Families and Health Practitioners. About a week later, I put in a request for a book about the 1986 Chernobyl nuclear accident. That one came in lickety-split. Our library system here in Toronto practicing active censorship and restriction of information. Are you really okay with that? Seems to me like a pretty slippery slope. Those of us who've done our research know there is plentiful scientific evidence about risks and harms associated with vaccines. Hey, just read a vaccine insert before they start trimming information out of them, that is. When you follow the money regarding the role of the pharmaceutical industry and vaccines in modern healthcare, what do you find? A hugely profitable industry. Profits skyrocketing. Measles scares are very good for Merck. And no incentive to make vaccines safer or more effective given that 1986 release from liability. Please do some research into the pharmaceutical industry lobbying that took place in New Brunswick this year. I provided a link in my letter of 20 questions sent to you last week.
I'd ask you just to wrap up in a sentence. You're just over 3 minutes. Thank you.
We are all entitled to bodily integrity and the right to refuse medical procedures we have reason to fear may cause us or our children harm. This must never interfere with our children's right to receive a public education. We are also entitled to the free and open circulation of information. These are our rights in a free and democratic society.
Thank you very much. Are there any questions for the deputant? Thank you. Seeing none. Our next speaker